Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullah. My name is Samir Ali and I'm a chaplain with Hospice. Today in a few minutes, I would like to speak to you about the philosophy of hospice and how it is different from the hospital. A good way to think about it is that when someone is admitted to a hospital for a condition or a disease or an illness, the project and the idea at the hospital is to provide medical interventions, is to provide testing, is to provide medication or chemotherapy, for example, in order to provide cure for that illness or condition. So someone who has cancer may be facing chemotherapy. Someone who has other illnesses may be facing medication that they will have to take, and then they will come back and test for that illness if it's gone or receded. Hospice comes in when that patient chooses not to pursue any kind of cure, or when the medical science has said that we really don't have any cure for this kind of illness, so then that patient is transferred to hospice. The philosophy of hospice is to provide comfort and not to provide cure. So when a patient already comes into hospice, the idea is that we are not going to pursue any cure for this disease or illness or condition, and we are going to provide the comfort for the patient and for the family. That being said, that comfort is available at many different levels and many different ways in hospice. One way is that the pain is managed, and the pain that the patient has is managed by the nurse, where the nurse is giving medication, and then there's a physician who is overseeing all this process, and that medication is there to remove any pain or discomfort that that person may have. So really, there are a lot of options available in hospice, and there are different levels of care that are available at hospice. Hospice is a philosophy that can be practiced anywhere. When a patient is ill and they go to the hospital, usually their journey is between hospital and home and maybe some labs where they go for testing. Hospice is even more flexible. Hospice can be available at home. When someone is ill at home, they can have the nurse come and they can be on hospice. They can be at an assisted living facility. They can be at a skilled nursing facility. They can be at a community facility where the people of the community are living. And they can even be at the hospital. So hospice is available in different kind of settings, and it's just the idea of hospice and comfort that comes to the patient. The patient doesn't have to really go anywhere when they are on hospice. So that's something that we should keep in mind. Another thing is that on hospice, there are several types of medication available to manage the pain and the discomfort that the patient may be having due to their illness that is no longer curable, or they have chosen no longer to pursue the cure for this illness. Hospice can be available at inpatient units that are available, and they are built only to provide care to the hospice patients that are at that inpatient unit. Another thing about hospice is that besides the medication that is administered and followed up by the nurse or maybe a director of hospice that's available, there are different levels of care that are also presented to the patient and to the family who's on hospice. For example, there's a social worker available, and the job of the social worker is to make sure that the finances and the financial help that is needed by the family is available. There's a chaplain who provides socialization for the patient, who provides emotional support for the patient and for the family, and also provides the spiritual support and prayer for the family. Sometimes there's music therapy available for those who would like music. Sometimes there's also massage therapy available that they come and provide comfort for the patient. And there are different kind of options available in hospice. So really it's a philosophy to provide comfort to the patient at many different levels and many different ways. And we usually don't think about it, but that is something we should be aware on hospice. And one last thing that's also presented on hospice and available is that there's bereavement support. So usually the social worker and also the chaplain provides support for the family who is mourning their loved one who is now expected to pass away on hospice. And there's bereavement support even after the patient passes. The hospice staff, including if there's a grief support person and a bereavement support counselor, working with the chaplain, working with the social worker, they provide support to the family even after the patient has passed. And even for a few months, there are visits made or phone calls made to the family to make sure that they are being helped in the process of grieving and mourning for their loved one. So that, in a nutshell, is the philosophy of hospice. Assalamu alaikum wa rahmatullahi wa barakatuh.